top story tonight, move over, Pat Sajak. Obamacare wants to dole out contest prizes, too. The Health and Human Services Department is sponsoring a contest for young adults to make the best video promoting Obamacare. Now, the agency is spending $30,000 in prizes, so the most a contestant can win is $6,500. The first 100 participants do get a Stay Healthy kit, which includes a T-shirt, a first aid kit, sun protection kit, and a water bottle. But can cash and free T-shirts get young Americans excited about Obamacare? Here to weigh in, we've got Sam Batkins, Director of Regulatory Policy at the American Action Forum. Thanks for being with us, Sam. So how's this going to work? We're going to try to get the young Americans who basically are facing price increases of 30, 40% and more because we got to spread some of the costs from the sick, elderly onto the young. We now hope to get them to actually do films extolling the wonders of this new plan.
Yeah, I don't know that you're going to get a lot of 20-somethings checking HHS's website to sign up and to create these videos. I think they're more worried about their own financial future than deciphering this sort of incomprehensibly complex law.
Yeah. Now, it seems to me that the Obama administration got the drug industry to agree to spend $100 million advertising Obamacare. Then it was pressing regulated companies to contribute to a fund to implement Obamacare, and it also approached celebrities and NFL football players to do something to promote the program. It seems to me, is this a sign of great marketing or a sign that the administration is somehow worried they've got a program that no one likes?
Yeah, I think they're pretty terrified that their, quote unquote signature domestic achievement is sort of crumbling before their eyes, at least in terms of the public perception. I think they're aware of that. I mean, look, they've already repealed the 990 reporting requirements. The Class Act is gone. It looks like the medical device tax is next. They've delayed the employer mandate. And I think that they're worried that this could be a train wreck, as Senator Max Baucus described it.
Yeah, now, reportedly, Obama administration has missed 41 out of 82 deadlines so far mandated by the new health care law. And coming up on October 1 is when people are starting to sign up. What do you figure happens then?
I think everyone agrees this is going to be a sprint to the finish, but it's certainly not going to be a perfect sprint to the finish. We've looked at the implementation of the law over the last 3 years and found roughly 200 errors from implementation already. Sometimes they've had to make corrections to existing corrections to regulations. So I think everyone agrees that this is not going to be a perfect track to October 1st, and I think that's what really has the administration concerned.
Now, I'm sorry to ask this, but isn't it actually smarter for a young person in this country, rather than pay some 40% price increase in premiums to be covered by Obamacare, to simply go without any coverage at all? The penalty is only $95 starting out, and the companies can't rule me out for pre-existing condition, right? So if I get hit by a bus tomorrow, I can then go sign up for insurance later.
I mean, you're right. There are a lot of really perverse incentives in the law. The initial penalty is going to be really small, and a lot of individuals who are actually on their current plan now might actually get pushed onto the exchanges because there's just so many incentives. The employer mandate, when it fully gets implemented, as an example, that are going to push individuals onto the exchanges or out of their current health plans altogether.
Now, in the administration's favor, though, do you think actually getting some young people to make some hip young videos might be a good thing to do to try to talk more young people into signing up, even if it means higher cost of health care coverage?
Well, I think they're sort of scraping the bottom of the barrel if they're now turning to YouTube to really, generate support for the law. But I mean, who knows what can happen? I doubt it'll be on YouTube's top 10 by the end of the year, though.
Yeah, actually our brain room, the Fox News brain room, did some research on this, and I was trying to parallel this to previous government programs, and I don't find some big groundswell of advertising campaigns telling people to sign up for the original Medicare in 1965. I mean, they did some stuff for Medicare for drug coverage back in the Bush administration, but overall, this is a higher level of marketing of a government program that aims to do well than I've ever seen. What do you say?
I mean, yeah, this is a law that the administration really, really wants to work at. It hasn't gone as planned. It didn't go as planned in Congress. We've mentioned all the missed deadlines and all the regulatory errors. I think they're turning to wherever they can to make this work in any way possible.
Well, I hope it does work, because the country could use it. But I can't wait to see how some of those videos turn out on YouTube. Thanks for being with us tonight, Sam.